In this video, there's one nutrient that truly saves the kidneys, a single nutrient that people need to eat more of. And no, it's not protein. I'm talking about the kidney diet, a miracle plan where you swap out foods like beef, soda, and junk food for things that actually help your kidneys. Starting a kidney diet can feel like being thrown into a maze with no map. But here's the thing. When you stop stressing over all the tiny details and instead focus on what really matters, everything gets so much easier. I'll show you which nutrient makes the biggest difference, the one that, according to science, every kidney patient needs to focus on. So, what nutrient best protects the kidneys in a kidney-friendly diet? Is it protein? Spoiler alert, it's not. You might have already guessed that, since it's in the video title. And don't get me wrong, it's not that your body doesn't need protein, of course it does. But the truth is, 999 out of 1,000 kidney patients are getting too much of it. So yes, protein matters, but so does avoiding it. So what nutrient do you actually need more of? I'm not just going to tell you, I want you to figure it out yourself. Let's see if you can spot the nutrient that all these people had in their diets. There's one nutrient they all loaded up on to improve. Comment below if you know the answer. The first comment comes from Cecilia Rodriguez. She says, "My GFR went from 20 to 40 in 8 months. I completely avoided animal protein and I'm eating okra, bitter melon, celery, garlic, fresh lemon, and oatmeal. What an incredible transformation, from stage 4 to nearly normal stage 2 in just 8 months. That's the power of smart choices." So she's eating okra, bitter melon, celery, garlic, lemon, and oatmeal. What do all of those have in common? Let's check out what the next patient says. This comment is from William. "My eGFR was 54, now it's 98. I eat blueberries and watermelon daily. I also eat strawberries, 1 to 2 lemons a day, raspberries, cherries, pineapple, red cabbage, and red onions." William had an amazing improvement, and he's eating watermelon, strawberries, lemons, raspberries, cherries, pineapple, red cabbage, and red onions. Guys, what's the common thread among all these foods? Could it be a vitamin or an antioxidant? What nutrient could be making the difference for these people? Let's read one more comment, maybe it'll clear things up. This one is from a viewer named Great Life. "My sister was diagnosed with stage 3A. She changed her diet, no alcohol, no more sugary foods, but a lot more vegetables." Okay, let's add vegetables to the list. Are you starting to see it? We now have a list that includes okra, bitter melon, celery, garlic, lemon, oatmeal, blueberries, watermelon, strawberries, cabbage, onions, and vegetables in general. Clearly these are kidney-saving foods, but what's the magic nutrient that ties all of them together? Pause the video and drop your answer in the comments. Ready for the answer? There's only one nutrient that's present in large amounts in all of these foods. It's fiber. We have a winner. The nutrient that people need to eat more of if they want to improve kidney function is fiber, the underrated, often overlooked nutrient that's absolutely essential for gut health on this planet. It's the only nutrient that can directly protect kidney function. No other nutrient can bind to uremic toxins in the gut and help eliminate them. Science confirms what your grandma always knew: eat your veggies, or deal with the consequences. There's a strong inverse correlation between how much fiber you consume and how fast your kidney function declines. In fact, researchers believe increasing fiber intake can even improve kidney function. Fiber might just be the only thing in life that actually delivers on what it promises. So how does it work? Simple. Fiber keeps your gut healthy, reduces inflammation, and controls uremic toxins, according to a review in the Clinical Journal of the American Society of Nephrology. And honestly, who's going to argue with people who name their whole publication after kidneys? Researchers from that nephrology journal also tell us that you might not be eating enough fiber right now. Almost no one does. Not you, not me, not that person on Instagram who constantly posts pictures of quinoa. And do you know why? In the case of kidney patients, it's mostly due to outdated nutrition advice and the need to limit potassium intake. What recent scientific research tells us is that to improve kidney function, you need to drastically reduce your protein intake and significantly increase your fiber intake, of course, without turning your blood into a potassium smoothie. And if you think this information is helpful, feel free to share this video with someone who still thinks French fries are vegetables. Don't keep all this wisdom to yourself. Do you also want to know which foods are high in fiber and as low in potassium as possible? And maybe you'd like some tips on foods that not only contain fiber but also offer the strongest kidney protective benefits? I think we can do that, starting with foods that have the best fiber to potassium ratios. And don't miss the end of the video because there's a new fiber supplement that, according to research, is even more powerful than Acacia Fiber. But first, let's focus on food. You should be able to see some kidney-friendly foods that are low in potassium and high in fiber. These foods are ideal for a renal diet. Really, any patient can eat these. Low protein, low potassium, high fiber, what more could you ask for from a food? Actually, some of these foods also come with specific recommendations to make them even healthier. For example, popcorn, many people just see it as another snack. But the truth is, popcorn is a whole grain, meaning the bran, germ, and endosperm are all still intact. This makes it rich in fiber, especially insoluble fiber, which acts like a scrub brush for your digestive tract. However, all the health benefits of this whole grain vanish the moment you add butter, salt, caramel, or if you buy prepackaged or microwave popcorn. Just buy the raw kernels and air pop them. Then add a little cinnamon, pepper, or chili instead of salt, a very healthy snack. You'll also see raspberries, cranberries, and blueberries. Most berries are low in potassium and high in fiber, that's why they're always recommended for kidney patients. Plus, they're rich in antioxidants, which might be the most powerful micronutrients when it comes to kidney protection. While cranberries might not be as tasty as other berries, they offer significant health benefits. They help protect against urinary tract infections. This is a common and painful problem, and this food can really make a difference. Of course, there are many other foods you can and should add to your daily diet: cabbage, cauliflower, zucchini, lettuce, apples, pears, the list goes on. These are the stars of a renal diet, low in potassium, high in fiber, and extremely nutrient-rich. You can eat these every day, even if potassium levels are a concern for you. You'll also see some specific cooking tips to reduce potassium even further. For example, want to lower potassium in apples? Peel them. Want to get the most out of cauliflower? Boil it to remove potassium. These tips are valuable, they help you get more fiber with less potassium. But if you've been following me for a while, you might remember that I sometimes recommend the opposite: keep the peel. Don't overboil your vegetables, because that's how you preserve the good stuff: antioxidants, vitamins, minerals, all the protective compounds your kidneys really need. And even if that means you consume a little more potassium, sometimes it's worth it. So what should you do? Keep the peel? Remove it? Boil your veggies into mush? Or maybe throw away the veggies and just boil the peel. Don't do that. Here's the real answer: it depends. For some patients, maximizing fiber and antioxidants, including from the peel, is essential. For others, it's all about reducing every milligram of potassium, which means peeling, boiling, and playing it safe. And what makes the difference? Many factors, including the stage of your kidney disease, the medications you're taking, your serum bicarbonate levels, and of course, your serum potassium. In reality, diet alone is rarely the only reason for high potassium. The real culprits? Medications, uncontrolled diabetes, low serum bicarbonate, and even constipation can be major contributors. So please, don't gamble with your kidney health based on internet guesses. Instead, get a real plan made just for you. Now, you might be asking, does following a proper kidney diet really matter? The truth is, it matters more than most people realize, because your diet isn't just a supporting tool, it's the foundation of your entire treatment plan. For many patients, it's the difference between seeing your GFR go up or down every time you get a new set of test results. Those amazing improvements I mentioned earlier? They weren't luck, they were the result of personalized care, commitment, and the right diet. In the US, many doctors simply don't care about their patients. I'm going to give you a list of things to take your kidneys from a GFR of 54 to 98. So, if you're ready to stop second-guessing your meals and finally get the clarity and direction you deserve, I offer one-on-one consultations, completely personalized and designed with you at the center. My offer includes a tailored kidney diet based on your labs, symptoms, and CKD stage. It's a science-backed approach that's been proven effective with real patients, just like the stories you've heard today. Now, let's talk about what might be the highest fiber food per bite that you can find. Yes, the king of low potassium fiber. What food is that? Surprisingly, it's not kale, not lentils, and not some magical root vegetable you can only find once every solar eclipse. It's a super-processed boxed breakfast cereal. I'm talking about shredded wheat. Yep, the least exciting sounding food in existence. It sounds like something your aunt eats while silently judging your life choices. But guess what? It's packed with as much fiber as your aunt packs guilt into every family dinner. This food is made from just one ingredient: whole wheat. No sugar, no preservatives, no cartoon tiger on the box trying to convince you it's part of a healthy breakfast, just a wheat biscuit that's cooked, shredded, and shaped like a pillow. That's why it's rich in fiber, because it's a whole grain. It doesn't look as appetizing as a fresh bowl of oatmeal. But see, this little biscuit has no sugar, is low in potassium, and is actually full of fiber and nutrients. It's pretty healthy for a packaged food, though I'm not saying you have to eat it every day, just that it's always good to have options. Now, we've seen some great high-fiber foods, but every time I talk about fiber, there's always one question in people's minds: should we be taking fiber supplements? Researchers say we don't get enough fiber even when we try. And really, supplements were made specifically to address that. So here's the good news: fiber supplements are great for your kidneys. They're strongly supported by science as a way to help kidney function. I mean, fiber is fiber, right? And with a supplement, you can even choose what kind of fiber to take. Speaking of that, you may already know that the most recommended fiber supplements for kidney health are Psyllium Husk and Acacia Fiber. However, there's one fiber supplement currently being studied as not only a way to protect the kidneys and improve gut health, but also to help manage mineral and bone disorders and CKD, which is incredible. How can a fiber supplement help with bone issues caused by CKD? because it may reduce the amount of phosphorus you absorb from food, along with other kidney toxins, and that would be amazing. That would make this supplement even better than Acacia Fiber for CKD patients. So, what supplement am I talking about, and does it really work? Well, this amazing supplement is called Inulin. Have you heard of it? You probably should, because if you've ever taken a probiotic, chances are you've already consumed Inulin. Yes, the reason Inulin can be so helpful is that it's unbeatable when it comes to feeding the healthy bacteria in your gut. But does it actually make a difference for your kidney health, or should you stick to more well-known options like Acacia Fiber or Psyllium Husk? Here's where you'll see the pros and cons of the most studied fiber supplements compared to Inulin. Now, I've also included Psyllium Husk. Why? Because Psyllium Husk has a benefits list longer than the side effects section of your blood pressure meds. Yes, it's that good. It can make a difference with cholesterol, diabetes, weight loss, gut health, and more. Acacia Fiber is also amazing because even though it doesn't offer all the benefits of Psyllium Husk, it's much safer in the later stages of CKD. In fact, while Psyllium Husk requires more water intake to be safe, Acacia can be taken with just enough water to swallow, and you'll still get strong kidney protective benefits. And last but not least, Inulin, as I said, is the most powerful supplement when it comes to feeding the good bacteria in your gut. And doesn't that make it the most powerful fiber supplement of them all? Even more powerful than Acacia Fiber, how amazing is that? Now, a quick note, if you're thinking about using Inulin to lower your phosphorus levels, the big study on bones and kidneys involving Inulin? It was done on mice, right? So unless you're a very literate mouse, we're not entirely sure whether Inulin is better than Acacia, but it does show promise, and I'm watching it like a hawk. Because in reality, even if we still don't know whether Inulin is better than Acacia, it's an extremely safe and commonly used supplement today, and it might make a difference. All the dosages are included, tips for taking supplements and everything. And remember, choosing the right kind of fiber supplement isn't just a nutritional choice, it's a powerful move against kidney decline. Finding the right fiber supplement is an important decision, so if you're unsure, ask your doctor. One question I always get when talking about this stuff is, what if I have diabetes? Aren't all these super healthy foods bad for me because they have carbs? Should I eat more protein instead? I recently made a video to answer exactly that question, along with a few others. Be sure to check out my next video. And that's all for today. Thank you for watching. God bless you all. Goodbye.